Hey everyone, I'm so happy to be here and be a presenter at the International Youth Day. Yeah, my name is Zacharie Mulumba. I'm a medical doctor in the Democratic Republic of Congo. I also work as outreach and partnership manager at Hesperian Health Guides. Uh, an organization, a nonprofit in the US. And then I have already been selected as Mandela Washington Fellowship 2025, and I had a very good time and program at Michigan State University this summer. Yeah, slide, please. Okay, so I'm gonna present a little bit. Hesperian Health Guides, it's an organization that exists for 50 years now, and Hesperian's mission is to produce health guides to help underserved and rural population have access to essential health information that they need so that they can make informed decisions about their life. So the very popular book of Hesperian is Where There Is No Doctor, which is a guide that provides information about how to take care of how people can take care of themselves or take care of others in very low resource area or zone. Slide, please. Yeah, and this intervention we made in East DRC, it was in partnership with a local organization called YAR. It's the Youth Alliance for Reproductive Health in DRC. They are working in Goma and Bukavu. So their mission is to improve sexual and reproductive health for adolescent, youth, and women in the Democratic Republic of Congo and beyond. Yeah, so they ensure legal access to information and services, empowering young people to make informed decisions about their health and well-being. Slide, please. Yeah, so Hesperian developed three mobile apps to reach populations where they don't have good logistic or population very difficult to reach. That is the case of East DRC, as you will see it in my next slide. So the three mobile application is family planning, the Safe Abortion app, and then the Safe Pregnancy and Birth app. Slide, please. Yeah, now I come to my presentation. The title is Empowering Communities in Conflict Zones Through Mobile Health Education, a youth-led digital response from Eastern DRC. So we use those mobile applications to bring health information to young people in this part of the country. As you may know, there is so many challenges we are facing right now. Slide, please. Yeah, so what is the context in Eastern DRC? We have a health crisis. So we have more than 30 years of armed conflict in North and South Kivu. All the medical systems collapse, and then that leads to a high rate of adolescent pregnancies, unsafe abortion, maternal mortality, cultural taboos in that region, and misinformation around sexual and reproductive health. Slide. Yeah, so the challenges we can find there is a limited access to reliable health information. As you may know, in conflict zone, it is very difficult for health workers or educators to do their work. And there is displacement and trauma affecting women and girls, stigma. stigmatization of contraception and abortion, insecurity, preventing outreach by health professional. So this picture, it was in a refugee camp in East DRC. Slide, please. Yeah, so the what was our response? We partnered with DRC because they are a community-based organization and they know their area. And then we equipped them with three mobile applications to provide sexual and reproductive health services and health education in the community. So the three apps, as I said it before, is the family planning, the safe abortion, safe pregnancy, and birth app. So these applications are free and they can use them offline after download. They don't need internet connection to have access to information. So the French language is available. And then there is a local language that is spoken in the region of the country, the Swahili, which is available. And those applications are accessible to everybody, even for people who can't read, who don't have enough education to read. So we have the read aloud functionality in this application that can help someone just click on the button and then the app will read the information automatically for them. Next slide, please. Yeah. Okay. So the implementation of this activity, this project, so we trained P educators, 20 youth leaders who could go in the community to raise awareness campaigns on the use of these mobile application. And also, we reached more than 50 providers and trained them to the use of this mobile application and the information they provide in order to raise awareness campaign in their communities. And then after 3 months, we reached 6,010 I can say 610,000 people. That was via social media. And then we increased the downloads during that period. We had more than 4,600 downloads of Hesperian mobile application. That really testifies that there was a need, a real need in that community, and this need has been addressed by this mobile application. And from that period up to now, the application downloads in that region are just increasing, and especially uh, safe the safe pregnancy and birth app. So those informations were the most downloaded and the most consulted by youth, by young people in that part of the country. So we had a field outreach in Goma, Bukavu, the areas under the control of rebels right now. Slide, please. So the impact, we increase the confidence and knowledge among women and youth. Uh, Young people could make safer decisions in sexual and reproductive health. And then we had the creation of local sexual and reproductive health champions. So those young people who have been trained during this project today they have become champions in their community, training others and raising sensitization campaigns. And then this model shows the potential for scale and replication in other war zone or difficult to reach zone in the world. Slide, please. So the lesson we learned is that youth are trusted messengers in times of crisis. And then mobile tools are powerful in hard to reach areas like war zones because we don't need so much logistic to bring the information to the population. And then the community ownership increases long-term impact. So as I mentioned, the project was just for 3 months, but the community, they took the ownership of this mission of this mobile application, and up to now, the numbers of users are just increasing because people are talking about these tools, these mobile application around them. So this increases the long-term impact of the project. Slide, please. So the call to action, so we are seeking partners in sexual and reproductive health in Francophone Africa countries. Uh, yeah, and most of the time we provide small grants to these organizations so that they can support expenses related to the organization of the different activities they need to disseminate and talk about this mobile application. And then we are our goal, our long-term goal is youth empowerment. Yeah, and we call everyone who want to join us in scaling health education in difficult to access areas in the world. Slide, please. Yeah, thank you. Thank you for your attention and for your time. Yeah, during this presentation, you can see my contacts there, and I will end by saying, even in conflict zone, knowledge always save lives. Thank you.